Hello and welcome to another episode of BioNexus Health podcast series. Today we have with us Carol from South Carolina, who has agreed to share her story of her two children, Anna and Aiden, recovery from pandas type issues, Lyme disease, co-infections, mold exposure, CIRS, and biotoxin illness. Let's welcome Carol to the show today.
Welcome to the BioNexus Health Podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie Dashore.
So Carol, welcome to today's podcast. How is South Carolina today, and how are you?
Well, the weather is fantastic, and so we're enjoying that. And, the kids are active and enjoying the weather, so it's all good right now.
Well, thank you so much for being here today, and it's deeply appreciated. I know you've had quite the journey with Anna and Aiden, so I appreciate you sharing their story of recovery with me.
Absolutely. I wouldn't have it any other way if it means I can help other families, because it is, heartbreaking to go through this many, many years, and happy that we could finally find you for some answers. So happy to do it.
Let me ask you about your kids, and you can speak about both or speak about one at a time, any way you prefer. Can you describe the challenges that you faced over the years? Did you ever receive any kind of a diagnosis? And what brought you to plant-based medicine and BioNexus Health?
Well, I can start with my son. There were many challenges at the very beginning that didn't ever make really a whole lot of sense to me. He was born very, very small. He was actually born at 5 pounds, and it was at 42 weeks, which didn't make a whole lot of sense to anyone. We really didn't understand that because it never really showed up in ultrasound. So we were challenged from the beginning. He was very delayed. He was sick all the time. I kept contributing it to the size at birth. I kept going back to that year after year after year after year. I would just say, oh, it was because he was small at birth. He never took a bottle properly. He never fed properly. We would have to go to feeding therapy on a constant basis, because we later received a diagnosis of sensory processing disorder. So that's how that started making, I guess, some sense, right? He couldn't be around any sounds. He would crawl underneath tables if a FedEx truck was coming down the street. The occupational therapy was helpful to an extent, but it later became increasingly sick, as far as numerous visits to the ER, which looking back, I sometimes associated it with maybe the vaccine scheduling. He had constant antibiotics, breathing treatments. He had his adenoids taken out, thinking that would assist. Then in the 2nd grade, he got a bullseye rash from a tick bite from going to Pennsylvania for a summer trip with his grandparents. And unfortunately, my husband visited up there, at the end of the trip, and found something on his face and said, you have something on your face. It's a little black mole. And he was picking it off, but it came off. And unfortunately, we don't know how long that black tick was on his face during that time frame. He came back from vacation, and I immediately saw the bullseye rash, immediately called the pediatrician, took him in, and the pediatrician said, oh my gosh, we don't see this much, in our area, but we need to treat this, and treated it with an antibiotic. From that point forward, though, he never really came back around. He just seemed to get more and more sick through the years. And so at that age, he was probably, let's say, maybe around 9. And, we were able to come into treatment with you about 2.5 years ago. So it was probably, around, 11.5 to 12. So thank the Lord, we were able to find you, because I was at my wit's end seeing many, 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 many doctors. So that's my son's story. My daughter was born a few years after my son, and I was hoping for the best. I was hoping for maybe a different situation. But however, she seemed to follow the same footprint as my son. She didn't feed very well, but it was more manageable. She needed OT for mild sensory processing and speech delay. Unfortunately, she was sick constantly as well, had constant antibiotics for chronic sinus infections, ear infections. She had 3 sets of ear tubes, adenoids removed. She had horrible burning rashes on her face that went on for a full year that not one doctor could ever explain to me. We went to numerous doctors, numerous dermatologists. Nobody knew why this was happening. Allergy, test after allergy test. I'd pick her up in the middle of the day from school because she would be screaming and crying of this burning rash on her face. And then in kindergarten, she was also up at that trip with the grandparents in Pennsylvania. And we think possibly she also was bit by a tick because she was playing in the same area that our son was playing at. That the unfortunate part of it is the deers cross through this specific area in the backyard of the grandparents' house. So she also came back from that trip not feeling very well, very fatigued. I definitely thought something was strange, but I had no proof to prove otherwise because she didn't have a rash. So she also started getting more and more sick through the years. And so with 2 children, very sick, doing constant breathing treatments and antibiotics for sinuses and ear infections. And as a working mother, I was pulling out my hair at this point, to say the least. So after numerous doctor's visits with no one helping and no one giving me answers and not even could answer this massive rash on my daughter's face, I turned to the internet. And I turned to education and trying to learn and trying to figure this out. And I started learning more about mold toxicity and, Lyme disease. And I knew I didn't want to go down the route of, putting a port in my child's, body and doing antibiotics. So I knew that I had to find another answer. And luckily, that is when we discovered you, thank the Lord, 2.5 years ago.
Okay. That has been quite a traumatic journey for any mother to go through.
It was traumatic for me, and quite frankly, it was traumatic for the kids
children,
too,
of course,
because they were waking up in the middle of the night sick constantly. My son was throwing up all the time, didn't know why. I was cleaning up throw up constantly from his carpet, and I was just like, this isn't normal. Like, children don't live like this. And I just would go year after year after year trying to keep up with a full-time job, my marriage, and then of course taking care of 2 children that, looking at them, they're beautiful children, you wouldn't even know that they were sick, and everybody thought I was crazy, actually. So they didn't see the
I hear you. Yes, that mirrors the story of many moms and many individuals dealing with, this so-called invisible illnesses, and mainstream seems to call them that. I think it's just ignorance, lack of awareness, which is growing, thankfully. But yes, can you take us through the various testing that we did, and what did the testing show, if you recall? And ultimately, we started the herbal protocol. It was individually customized for each child. And how did you manage on this? How did you manage to convince the kids to do all of these herbs? Were there any taste issues? How did you manage with that? So if you wouldn't mind going through that with us.
Absolutely. So, it is interesting. My children actually really mirror one another. So there really wasn't a whole lot of massive differences in their treatment protocols. So they kind of had to do it together. So with Anna, we started treatment with her first. Once my son, Aiden, actually started seeing that, Anna had these results, then he was willing to jump on board too. So we kind of almost did it, together. There wasn't a whole lot of time in between, but they do mirror one another as far as some of their results, because they both obviously showed the mold toxicity, and they both obviously showed the Lyme. Because we started with Anna, she, at first I was kind of like, does she really have the Lyme? Because we didn't have the bullseye rash. But once we did that urine test, which I'm so happy we did, we realized that she did. And so that was kind of a shocking aha moment for me, because all these years she was, living like this, and we didn't absolutely know that she had that. So at that point I was ready, to sit down with her at a very young age and explain to her how important that this treatment plan was, because we really truly wanted her to turn around, with her health. And she did too, to be very honest with you. She was ready. She was done with going to doctors. And that's how we explained it. We have to give this our all, because this is what we have left. And I have a feeling that you're going to be surprised how, you're going to feel once we start this. So it took a little time, obviously, and it took a little adjusting for me, because I was having to learn how to put these herbs together, and I would do it on like a weekly basis, and I would put them in a box and I would have them in the refrigerator. And, we kind of just got used to it eventually. And it was a part of our schedule. We would do it in the morning, before we went to school. We would do it in the afternoon when we got home from school, and we would do it at night. And they all, both my children got very used to that. This was part of the schedule of being healthy. This is what we were going to do to turn around the health of our children. And what was interesting is about 4 months into this, I noticed that I was no longer calling the pediatrician. I was no longer calling the walk-in clinic. I was no longer picking them up in the middle of the day with illnesses and sicknesses and headaches and fevers. And they started also noticing it. And so they, at that point, realized that this was going to be a part of their life, and they were ready for this. And because of how they felt and being up, having the energy, not having the headaches any longer, feeling really good, jumping out of bed in the morning, going to school, being happy, and keeping up with all the sports that they do, because they're very active, it became a part of our life. And quite frankly, it's not even a struggle any longer. It's just part of what we do as a family.
That is just so amazing to hear. So all of you kind of banded together as a family to bring back the health of both of your beautiful children.
Absolutely. And we travel this way too. I mean, we'll take our air purifier, we take our herbs. They know this is part of the program. They take, their pills and whatever we need to do. We take everything with us, and it really truly isn't even an issue any longer.
I'm glad you mentioned that. Yes, that has been our story, like, similar to our story as well, but especially with the travel. Yes, as I had mentioned to you, that's exactly what I do as well. I always travel, whether I travel alone all over the world, I always carry my my herbs as well as my air purifier with me. And it's, it just becomes part of your life. It's just, you have to step up and take responsibility.
Well, especially now with sports, we are now traveling more. And so we're now on traveling leagues. And so when you travel, sometimes you don't get to pick where you stay. And that's been, a scary thing for me personally, because when you're staying in hotels that you don't know, what's there, if it's a healthy hotel but sometimes you don't have a choice, because these hotels are blocked out for the team. And so unfortunately, it's one of those things where we took our first trip on that league without the air purifier. We learned the hard way. We came back with a strep infection. So that's when I immediately called you. And I was like, oh my God, we haven't had a strep infection in years. Like, we don't even understand where this is coming from. I don't even understand. And then it was explained that when you're traveling, you have to be really careful about where you stay, and you have to have that air purifier. And so this has been a learning experience for us as well. And now that air purifier goes with us everywhere we go, and we have not had that issue again.
What symptoms did you see get better first? Like, how, actually, you mentioned that. You mentioned about 3 to 4 months into it, you started to see resolution of symptoms. Now, do you find that the symptoms stayed away, or do you find that they experience occasional flare-ups still?
Every once in a while, I will see a flare up, but it's very rare. It's very rare now, but it really truly is associated with the environment. I've now learned that, because, I can even tell when we are in public, going places, and, my daughter will immediately say, something smells funny in here. I really don't want to stay here much longer. And so her body has now become very sensitive to realizing, what might be good and what might not be good. Even my son, with certain gyms, that he'll play at, he knows immediately, oof, okay, I don't know that I want to stay too long in here because I can tell this is not an environment that is probably good for me. So they recognize, and they're very sensitive, sometimes to certain environments, but we're working through that too. And they seem to actually even be getting better with staying in that environment for a longer period of time without any type of, massive symptom happening. They might get a little headache or something like that, but we're not, full blown getting sick when we leave those environments any longer. So even with time, I'm finding that the kids are getting even better with the environments that they probably couldn't have gone into before.
You make an important point that both Anna and Aiden have realized how much better their health is now. I'm sure no child enjoys getting sick and having to take medications, going to the doctors, having blood drawn, being poked and prodded. So overall, looks like their immunity has been strengthened. Looks like, during the winter times, they're not succumbing to every cough and cold out there anymore. And that keeps them motivated to stay on their maintenance protocol, as well as a healthy lifestyle and healthy diet.
They're completely motivated. I can tell you this, they unfortunately used to get the flu almost every year. And it just seemed to happen every single year. I just said, okay, here we go. The flu season's here. Now somebody in school is going to have the flu and they'll have the flu. Well, I can tell you, since we've been with you, we have not had the flu. Neither of them have had the flu. And every single child, it seemed like, in their classroom had the flu. And I was like, oh my gosh, at some point they're going to get the flu. And this has now been 2 years of not having the flu for the first time. So that alone is a huge, thing for us as a family. And they used to get very sick with the flu. I mean, we're talking, a good week out of school. Children around them are constantly sick. And for the first time, my children are not getting sick. And it's almost this, I'm in a state of shock that we're not even dealing with some of the things we used to deal with. I used to be very panicked if someone around them were sick. And I used to be panicked about sleepovers, or, oh gosh, I might let them go to the arcade, but they're going to come home with something. And now it's not even on my mind any longer, which is a huge difference for them, but also for me as well. And we recognize it and we talk about it. All my children's friends understand, actually, that of their herbal treatments, and they know. They're like, you haven't taken your herbs yet, or your herbs are still sitting on the counter, why haven't you taken them yet? And so they know that that's part of my kids' lives. But my kids also say, oh yeah, that's right, I need to take those. And my kids understand the reason why they're taking it. So it's been one of the best things for us, and they understand the importance of it as well.
That's just so awesome to hear, that it becomes part of the child's life, and even their friends kind of understand that this is what it is. This is how things are to be done to keep Anna and Aiden safe, and this is part of their life. That's really wonderful to have true friends like that.
Absolutely. But they also are very interested too in learning sometimes. So that's been quite interesting too. So I almost feel like my daughter and my son are educating at the same time, which is really cool too. So that's how much they've learned as well through all this.
Yes. Were you surprised to find so many co-infections and so many toxins once we ran the lab test? Because you're highly educated yourself as a professional, and Lyme disease, tick-borne infections are the testing is so controversial. Additionally, we ran a urine test, and it it's a really good urine test according to my clinical experience. But bottom line is, Carol, that you can't really argue with results. If you have a child that is exhibiting symptoms, A to Z, and then once you start treating for underlying tick-borne infections, doesn't matter what testing methodology was used, doesn't matter how controversial that is, but if we are able to connect the dots with the symptoms, and the symptoms start to go away once the co-infections are treated, then, I mean, you can't really argue with results, right?
I agree, because the frustrating part for our family was we even had this bullseye rash, right? And so I
Right.
knew that we at least had that as far as evidence. And then we even went to some of the best infectious disease doctors within the area, believe it or not. And these tests that they would do still wouldn't even come back as showing this tick-borne, illness. And that was very frustrating for me, because it was like I was, beating my head up against the wall, even with some of the best infectious disease physicians within the area. And so it was almost like I was the crazy mom, even though I knew that something was not right and I needed answers. Even with the allergy testing, with knowing that, okay, well, something's not right. We need to go through all this allergy testing, and nothing would come up. I mean, it never showed anything as far as my children were concerned. And I have a lot of allergies, so I just assumed something's going to come up. Well, I would just keep testing and testing, and nothing would come up with that either. So we just kept getting no answers. And so having that urine test from you was the first time that I felt like, we're finally getting somewhere. We're finally getting to what we need to get to, relieve some of these symptoms for my children. Right. And so once you can connect those dots, and you knew exactly what herbs had to be placed with which, toxin, and where we needed to detox because of the results that we were finding, even in the blood work and the urine analysis. And the dots finally were connecting after, 9-10 years of searching and searching and searching with doctor after doctor after doctor. And, I even went to a lot of even, natural physicians as well. We still couldn't even connect a lot of these dots. So finally, I felt like we were getting somewhere. Let's just say that.
Mm-hmm. Mm-hmm. So no more. So you were able to get off with your kids, to get off inhalation treatments via nebulizer. The allergies were better. The skin rashes were gone. The sensory processing issues were all resolved.
Yes. We haven't brought that nebulizer treatment out since we started seeing you. And that was actually something that I wanted to scream and yell every single time I had to pull it out of the box, because it was so frustrating. I felt like we were doing that like in the middle of the night all the time. And my kids would wake up actually saying they couldn't breathe. And they would come into my bedroom in the middle of the night, and it would be that croupy cough in the middle of the night that I was like, oh my gosh, how many times are we going to have this cough that nobody can tell me where this is coming from? And many ER visits, because it was scary, because in the middle of the night, both my children would say, I just can't breathe. And we would even do the nebulizer, and still they would say they can't breathe. Mm-hmm. And so that was frustrating. And then of course, all the ear infections, all the sinus infections, and then not having any answers with that too. So finally getting answers. We have not pulled out that nebulizer. We have not pulled out a puffer. He has not come over to the sidelines from a basketball game, from a soccer game. My daughter hasn't come over from a volleyball game. They are breathing. And not only are they breathing, they're star, players on all of their, their activities. So for once, they're also seeing how active they are and how much energy they have and how they're excelling within their sports. But not only their sports, they're straight A students, both of them, in school too. So they're clearly thinking. They don't have some of the same frustrations in school as they did before. My daughter was diagnosed with dyslexia, and she, quite honestly, is not even having any type of accommodations any longer for any tests. She's not pulled out of any tests for extra time any longer. She is flying through subjects and reading material. And she also knows how clear her mind is now too. So for the first time this past year, after 2.5 years, she has not been pulled out of class all year long and hasn't needed it for any type of accommodation. So it's been wonderful.
What a turnaround. Wow. For both these kids. Carol, it's been such a privilege working with your family. And I always say this, it's such a privilege to be in my position. I'm so passionate about, I just love my job. To be able to change even a day in anybody's life is such a blessing and a huge privilege. So life must have changed for you as well, right? As a mother.
Oh, it changed a lot. I mean, I can tell you for the first time that I've been able to concentrate on my job, my profession for the first time. And so, things are very well on my career front. I mean, for the first time, I went for a promotion that I probably would not have gone for otherwise in the past, because I was fearful, oh, could I do this? The time frame and, the amount of time that it takes, the children and, my focus. And so on the career side of things, it's the best time that I've had in the 20 years of what I've done. And so I also thank you for that as well, because I even though the regimen is there, and yes, it is, it is a little bit of a reminder, that we do have to do this regimen. It's all worth it, because I feel like we are in our prime as far as, for my children and their lives, but then also the amount of time that I'm able to now even focus on my career that I wouldn't have otherwise in the past. So, we all thank you for that.
Of course. It's been my pleasure. It's been so amazing watching both Anna and Aiden, to move away from surviving to thriving, and that seems to be very fortunately a common thread amongst many families that have very kindly agreed to do the podcast to spread hope and education amongst families seeking help for their children from around the world. Pretty much, the world is, I find, is changing and leaning more towards natural medicine, which is centuries old, right? Herbal medicine in almost every country. There are phenomenal herbalists, and there have been for thousands of years. And plant-based treatment options maybe one day will become more mainstream than I guess, currently right now. This is asthma, allergies, dyslexia, sensory processing issues, pandas, Lyme, mold, mold toxins, environmental toxins. All of these within a child can be treated, can be detoxified without any invasive techniques. So without using any kind of invasive treatments. I'm so glad you have been detail oriented today and explained, exactly what was going on over the years with you as a family, as well as everything that Anna and Aiden had to endure. And I'm just so happy. I can't express. I'm so happy to hear that they're enjoying life, and so are you. You're enjoying having a career, moving forward with your career. Fantastic.
Yeah, no, I mean, I have you to thank, and obviously, I feel like as parents, probably search out more and more, right, for answers and for alternatives. I think that sometimes it's frustrating for a parent because, we rely on this Western medicine. And I think once you get to a point where you put your hands up in the air and say, well, that Western medicine has just been layering, medications and therapies and surgeries like it did for my two children. you get to a point where you do find other alternatives. And what you start realizing is you start learning a lot, about those alternatives. Like you said, you go back to these herbal type, therapies and answers. And so for me personally, I've learned a lot about myself and my children, and, some of the things that, have, awakened us to a whole new life of herbs. And quite frankly, it's been a wonderful life that now we have, and it's all natural, which is even better. So we are very, very happy to have you, and we continue this road with you as well, because it's been a wonderful journey for all of us. So even though it's been a tough journey, it's actually been one of the most amazing journeys for me, because the end result has been something that I know that I couldn't have found otherwise. So we appreciate everything you've done for our family. And I know I've told you that before, but I continuously will probably continue to tell you that. So thank you for that.
Of course. To summarize, Carol, can you give us in a few words the before situation with the herbal protocol, before the herbal protocol, the before situation with Anna and Aiden, and after the herbal protocol?
Of course. So to summarize, before Dr. Dashore, both of my children had many, many years of pharmaceutical medicine, doctors, ENT surgeries, occupational therapies, and frustrations. And after Dr. Dashore, both of my children live a full, active, healthy life, excelling in school and all of their sports that they play. So they also both know how important their herbal regimens are. And because, they don't want to go backwards, they only want to go forwards, especially knowing that volleyball and golf will only get more competitive as they get older. They know that their treatment plan keeps them healthy and competitive for the future years to come. So they know they have a second chance to life.
So thank you, Carol, for sharing your story with us today. So folks, we said goodbye to Carol, and it was amazing to hear, wasn't it? Full recovery from asthma, allergies, pandas, Lyme disease, co-infections, Marcons, mold biotoxin illness, food allergies as well, food sensitivities, skin problems. All of these, Anna and Aiden have a wonderful full life ahead of them now, all thanks to a completely plant-based protocol. That's the key, the key is to understand that there are natural options, non-invasive options available out there, and to find a local practitioner in any country that you are in. There are phenomenal herbalists I've discovered, in my travels around the world, that almost every country has phenomenal herbalists, clinical herbalists that understand natural medicine, and do feel free to seek out natural alternatives, seek out practitioners that think outside the box to help yourself, your children, your whole family. So once again, thank you for joining us on this episode of BioNexus Health Podcast Series. And I will see you next time. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.